The role that private hospitals, particularly in Lagos, have played in the treatment of COVID-19 patients has been shrouded in a lot of controversy. Despite abundant evidence that a great number of Nigerians rely on these privately owned organizations for their healthcare needs, why then is their contribution to the collective effort to combat COVID-19 being questioned? That really is the question. Admittedly, a number of incidents leading to infection and ultimately the death of some of these private practitioners has provided ready fodder to those who are against the involvement of private hospitals. But shouldn't their contribution be seen as relevant to winning this war? For more on this, we are now being joined by Dr. Ngozi Onyia, Managing Director of Paelon Memorial Hospital. Dr. Onyia, good morning and welcome to the morning show.
Welcome to the morning show, ma'am.
Good morning. Thank you for having me on the show.
Yes, thank you for joining us. I mean, you must have listened to my introduction. The attempt by the Presidential Task Force and other key players to, in my view, demonize private hospitals and question their involvement in the treatment of COVID-19 patients. Now, what the Presidential Task Force and the Ministry of Health are saying is that private hospitals should seek approval. Now, is there a system in place for getting this approval? You run a private hospital. Has there been any attempt on the part of the Presidential Task Force to reach out to chief medical directors of private hospitals to ensure a proper synergy between the public sector and the private sector in this major crisis that we face with coronavirus?
The answer to that question is an emphatic yes. There is a system for accrediting healthcare practices all over, at least in Lagos State. There's the HEFAMA, the Lagos State Health Facilities Monitoring Agency, Accrediting and Monitoring Agency. And they are the authority for accrediting any private practice in Lagos. And they are also involved now in accrediting hospitals to provide care for COVID patients. We must recognize that while COVID is just an illness, it is a biosecurity threat, so it's a national problem. It's a global problem, actually. And it has wider implications than cases of cancer or malaria. So I think what is being done now is guidelines are being issued now for the management of COVID patients. Hospitals will have to be restructured both physically and administratively for the safety of other patients and the safety also of the employees of the hospital. And then when that is in place and inspected and accredited, then they will be permitted to provide care for COVID patients.
Thank you, ma'am. Now, it's also important to note that I believe 70% of Nigerians today depend on private health care. And that is our unique situation when it comes to medical care in Nigeria. Now, given this fact, how important is collaboration looking ahead at COVID-19 and its possible implications across the country between the public healthcare agencies and our private sector medical care professionals?
It's absolutely essential. It's a no-brainer. It's inevitable. It's the only way to go. And I think the government recognizes this. But again, the press sometimes can be a bit inflammatory in their headlines. If one looks at the content of the articles, it hasn't said that private practitioners are not going to be involved. What it has said is that they have to work, they have to collaborate with the government. The government has to be a little bit stricter with the management of COVID for security and safety reasons. And that's the only reason why the government is first doing it in a structured way. We must remember that first, this virus is novel. The world has never seen it before. Every country in the world is learning by doing. We are learning as we are thinking on our feet, on the spot. So, yes, nobody's ever really prepared for it. And therefore, initially it looks like we were not prepared, both the public and the private. But I think slowly we are finding our way in. And we recognize that both as public and private, we will collaborate. The chief of staff of the president, God rest his soul, passed on in a private hospital in Lagos with the knowledge of the government. So there's a method to it.
Well, Dr. Onyia, we just had a conversation with Mrs. Enyamba Dafinone, who is a COVID-19 survivor, and she was treated at the Infectious Diseases Hospital here in Lagos, and she survived, and she has a happy story to tell. But in the case of the former chief of staff to President Buhari, Malam Abba Kyari, he was treated in a private hospital. First cardiology consultants were told, and he died. Now, in terms of capacity, is it not better for people to go to the public facilities where there seems to be a higher success rate? Because there are some people who are saying perhaps if Malam Abba Kyari had used the isolation centers and the official treatment centers, maybe the result will have been different. Do we have enough private hospitals with enough capacity to deal with this, in spite of the synergy that we talk about?
Let me start by saying the First Cardiology is a top-notch private hospital where almost a quaternary healthcare center, where they are doing things like interventional cardiology, so they are top of the range. That's the first thing. Secondly, that COVID gives a broad range of disease, starting from the asymptomatic, who are vastly in the majority. So many people, including me sitting down here or you sitting down there, might have COVID and not even be aware. Those are the asymptomatic, that's the asymptomatic disease. And there's a broad range from that. And about 80% will fall in that group, all the way to the few that die. Very few die, very, very few. So far in Nigeria, we have about 700 positive cases, and we have had about, I think, 21 deaths. That gives you an idea. No matter how incorrect those figures are, but it gives you an idea of the ratio of people who will die to those who will survive. So the point is that Mrs. Dafinone's illness was probably either mild, moderate, or severe. However, the chief of staff had a critical illness, and it's the people who are critically ill that do pass on. We remember when Boris Johnson was discharged from hospital, he said it was 50-50, it could have gone either way. So I don't think it's a reflection of the competence either of the public or the private that one survived and the other passed on. It is simply a matter of the severity of the illness. I must say that in addition to the equipment you require for critical care, you also require the expertise, the competence. And sadly, critical care is very underdeveloped in Nigeria. It's not something we have done routinely in the past. So most people who get critically ill in Nigeria just die, normally. So it's not an area of specialty that we have paid much attention to, because first, it's very expensive. Secondly, it's very intensive. And then in the end, the outcome, despite how, even in the best centers in the world, the outcome is often 50-50. That's the honest truth. And sometimes 70 to die and 30 to live, even in the best centers in the world. So the few intensivists we have in Nigeria are those who have practiced in the West and have returned to Nigeria after 20 years of practicing in the UK or in the US. There are very few, just a handful, well, a little bit more than a handful of them. I'm sure we don't have up to 20 of them in Lagos, I'm very sure of that. And most of them are in the private sector. That's the honest truth. They work in the private sector because they are usually people in their 40s, 50s maybe, who have practiced in the UK and have come back, what we say the brain gain. And most of them stay in the private sector because they find it a bit frustrating working in the public sector, having worked in other climes. So I think, to be quite honest, the private sector is probably, in Lagos, is probably slightly better poised to manage critically ill patients because of the issue of the competence of the personnel.
Thank you very much.
That's my opinion.
Thank you very much, Dr. Ngozi Onyia. And thank you for always obliging us each time Arise News reaches out to you. Thank you.